Okay, thank you, Helen. All right, thank you, Helen. Thank you, everybody, for the invite. Um, we have a lot to discuss, and don't put me in the firing range, okay? So, a couple of disclosures. Here we go. Okay. I don't have any financial commitments to any of the organizations I'm going to mention today, nor with the State Board of Dentistry. My comments, the information that I'm sharing today, while it did have to be approved through the administrative portion of the State Board of Dentistry, some of the things that I'm going to be saying do not necessarily represent, don't take them as the Commonwealth, okay? Take them, Donna Murray said, you can take it as that. So the opinions expressed there, many of them are my personal opinions and passion that sometimes I get a little emotional. So I'll apologize for that ahead of time. So today, some of the things I want to talk about in a little 10 minutes of time. I don't see my, I just want to talk about some ethics that can guide advocacy work, and we're going to talk a little bit more about that specifically. Today I hope to explore some different opportunities for advocacy within your community, state, or at the national level. And I also want to share, I'm going to share some resources for you on how you can participate in some of the things that were being discussed a little bit earlier with the panel before me. Okay. So, what does the State Board of Dentistry do? We do a lot of things. And when I began my term, I had gone to State Board of Dentistry meetings before I was appointed, and I found them extremely valuable, and I'll talk more about that. But I've also learned through the years that the State Board of Dentistry does a lot of work as a team and behind the scenes as well. So some of the things that we do, and I'm just putting them up for sake of time. I'm not going to read through every piece, every bullet point. But the main thing a couple things I'll just highlight is we do regulate the practice and the licensure of dental providers. And we ensure that anybody that's practicing, whether it's as an EFTA, a dentist, dental hygienist, that they have the proper credentials or certifications. We also make decisions on issuing those licenses, whether suspensions or revoking these licenses or certificates, and also investigates complaints that are filed. Now, myself, Donna Murray, do I investigate that? No. The State Board of Dentistry, the Commonwealth, has a team that investigates that, and then they bring those cases to us before the board for our information to help guide us in our decisions. Why do we do this? To protect the public from harm. That is our major, major role. And prior panel was talking about scope of practice. While we do make some decisions that guide scope of practice and has the potential to increase scope of practice, the main goal of the State Board of Dentists is to protect the public from harm. And that's done through some of these bullets here that I point out before you. The board in the Pennsylvania State Board of Dentistry, we typically meet on a bi-monthly basis. The dates and the agenda are provided ahead of time, and if you go to the website, which is right, I wish this was a little laser. If you go to the website, which will all be in this PowerPoint to be shared with you, you can find that information. These are the upcoming dates, and typically our meetings start at 9 with what we call the executive session, and that's for the for the Board of Dentistry public session. Okay. executive session where we talk about different cases or things, licensors and things that are going to come out. And then at 11 o'clock typically is a public session. In addition to the bi-monthly meetings that the State Board of Dentistry holds, sometimes there are other meetings that take place regarding a particular regulation that might be coming up. A couple of years ago was the PHDHP. There were several of us at the tables before I was on the board that would come and meet and talk about how that regulation was going to look. So sometimes there's additional meetings, but the public, it's posted, so the public always knows. There's no closed meetings, no secrecy with the State Board of Dentistry on comments that are shared. It's all public. Okay, at your table, I'm asking for a little audience participation. There are two scenarios at your table. They're over by the question, feedback. One of them is a purple one, and the other one is a yellow one, okay? So these are some scenarios that come before not just the State Board of Dentistry for Pennsylvania, but across the nation, okay? No names or anything. It's just to give you a little bit of an example of some of the things that come across the State Board of Dentistry and why advocacy for public health piece is important. Okay, so I'm going to call somebody because I see her reading right now. Yes, Carrie, I'm looking at you. Carrie, could you please read scenario 1? And Helen is coming up with the mic. Thank you, Helen.
Sorry, that one caught me by surprise.
Oh, sorry about that.
Scenario 1. A board-enforced investigation, BEI, is conducted due to the anonymous report. The following infection control issues were identified. Instruments with corrosion. I was reading the other one. Some of these are pretty bad. Presence of debris, dry blood, and cement on instruments that had been processed through the sterilizer. Absence of maintenance logs. Lacks of documentation for water testing and spore testing. Indications of reused disposable sterilization bags. Rodent droppings detected on counters.
Yep.
Are these real?
Yep.
Expired surface disinfectants and preloaded syringes in an operatory drawers. And office staff members observed in the sterilization area with no PPE, handling contaminated instruments while eating a bagel.
That one, some of it's kind of added in there.
A beverage is observed along with the autoclave. The dentist admits to the BEI that due to workforce shortages, the office is understaffed. The dentist states that the dental providers treat disadvantaged and underserved individuals with otherwise would not receive dental services within a 25-mile radius.
Drop the mic on that one, right? Okay, so I am looking at Cheryl. What do you think about that, Cheryl? If you were on the State Board of Dentistry and this case is coming before you and you're like reading this, what comes to mind? Especially given the last paragraph.
Well, other than I want to shut them down.
Right?
Now. I mean, the investigation has to take place so that this doesn't continue clearly and validate that what you're hearing is true for that as well. But yeah, I mean, it's just you can't allow that to continue.
No, we can't. We can't. So that's where, again, and I'm going to say this a few times, where the State Board of Dentistry role, we advocate for public safety. So a case like this has already been investigated. It's being presented to a dental board, not just Pennsylvania, but this happens everywhere. And then we have to make decisions on what's going to happen from there. Okay, so that's case number 1. Okay. All right, who else do I know here? Dr. Fike. There you go. Can you read scenario 2, please?
I'd be happy to. Scenario 2. A board enforcement investigation, BEI, is conducted after a patient, DM, is treated for a dental infection by dentist B. Radiographs and clinical examination reveal evidence of several root tips and an abscess. DM states he saw a dentist who pulled several teeth. DM also reveals having no insurance, limited money, and referred to dentist A by someone working at the local convenience store. Is that Wawa or Turkey Hill? Okay. Uh, to locate dentist A, BEI interviews local convenience store, there, once again, employees who show her a card with contact information for a dentist who accepts cash based on affordability. The address is an apartment located within the city limits. The BEI and team poses patients needing dental care. Once inside the apartment, they find a room has been set up with a dental chair, instruments, and a crude dental tray alongside dental drills. The individual posing as a dentist asks BEI, the posed patient, to have a seat and show area of concern.
Thank you, Dr. Fite. Okay, this is something that happened and was shared. I was in attendance for an American Association of Dental Board meeting, and this was a case that was shared with all of us. And this is something that was on national news as well. And it went really bad after that, after the posing dentist asked for more information from the said patient. It got to become very hostile, and at that point, the investigation and the officers, that were back in the room, they came in and they interceded, and they made some arrests. And when they were going through the said operatory, they found a handgun as well. So this person posing as a dentist, one, he wasn't a dentist. And two, again, this comes back to, for me, advocacy for public health safety. Because this individual was preying on the vulnerable population. And it's just, to me, it's just, Donna Murray speaking, not the board minister. It's just heartbreaking. We hear about these needs. We know this. This is why we're part of this organization or involved with, PCOH. But cases like this is not unique. There are people that'll go out there and they'll just prey on people, the vulnerable people that don't know, or they're trying to figure out, okay, this is my last, I only have this much money. One of our other presenters was talking about how often individuals will find providers based on referrals. So this came from a convenience store person, oh yeah, you can go here and this guy will take care of you. And no. So something else that does happen with the state board, things that come up, there's a lot of imposters out there. There are cases that come, not just Pennsylvania, but I work with other organizations. There are groups out there, and you may have seen them on social media, nail techs. They're going to do jewelry on teeth. They're going to shave down teeth to look a certain way. They are not practicing dentists. There are veneer techs. They're not licensed dental providers. They just take some kind of course and they set up in a hotel situation. Oh, we do veneers because we can do them all electronically or, through, printing. So these are the things that happen out there. And so today, one of the things that I just want to try and give you a different perspective from as a state board member is to think about becoming involved in the meetings, attending the meetings, to hear some of these things that are happening, to protect the public, to be more aware of what our scope of practice was. That was something else another panelist had revealed, that sometimes the dentists don't know what can a dental hygienist do, what can we not do, what can a dentist EFTA do. I've heard situations where EFTAs were doing things that dental hygienists are supposed to be doing, and I don't know why that happens. It clearly, to me, a provider should know their scope of practice. And if you're asked to do something, sorry, see you later. But there are individuals that won't. So what can we do, all of us in the room? I just encourage you to try to attend, and again, later on, there'll be some resources provided to you. I encourage you to participate in the meetings, the State Board of Dentistry meetings, for one. Now it's much easier because we have a hybrid. It used to be in person. Now there's a hybrid format. And initially during the pandemic years, I was really encouraged because there were so many people calling in on those meetings. And it actually got hacked that first time. That was like, if anybody was on that meeting, that was, oh my gosh, I felt so bad for Dr. Earhart. So now there's a hybrid. So if you live at a distance, just call in. Just call in. And the meetings for the public side typically start at 11. And if you got something else going on, then you just leave the meeting. Not a big deal. But I encourage you to try to attend. And for me, okay, this is Donna, the dental board member. For me, when I am at a meeting and I'm looking out in the room, and I see, okay, I already got her permission. And I see Marissa Swarney in the audience, right? Or at different times I've seen Sherry Myers in on the meetings. Those are so valuable to me. Or when it's read off by the administrator who's attending virtually, I'm like, ooh, I'm writing it down. Steve Neidiger's in attendance. Or there's always PCOH there. So and Dean Wolf has participated in the meetings. Dean Ishmael's participated in meetings, whether virtually, in person, and through letter writing. For me, as Donna Murray, I find that really valuable because if there's a certain discussion happening in the room, whether it happened to be with lasers or compact or whatever it is, or even this meeting, it's helpful that I can just slide something to the person next to me and let them know, ask Helen that. Helen's on the call. Ask her the question. She can answer that, So that, to me, is a way of all of you to get involved with the State Board of Dentistry because we do value what you have to say, your expertise. And a lot of times you're presenting different viewpoints that I, Donna Murray, may not be familiar with. So again, a little bit different perspective for advocacy, maybe not necessarily for scope of practice, but just to be more aware and advocate for what's going on. Attending the meetings is also helpful because it's a way of learning or being exposed to the whole licensure process or the different exams that are getting out there or different regulations that are being proposed. So for me, it's also a way of just knowing more about what's going on across our state. So again, I just encourage you to kind of think about the ethics. And if you see something going on, you're like, I don't know, is that person really a dentist person? Is that a dentist that's set up in that hotel? You go to the website, the State Board of Dentistry website, and you just file a complaint. And it can be anonymous. You don't have to put any other, just file the complaint and let the state take it from there and do the investigations and see. So just, if you see something that you're questioning, think about advocating for the public as well as, our profession, but more so the public, to protect the public, everybody, but especially the people that may not have that voice. So thank you very much. And I'm sure I went over my time, but you said it was okay.